when I'm talking about common sports injuries, usually we come across sprain and strains. Sprain which involves the ligaments, strain which involves the muscles. Usually common sports injuries are ankle sprains, people have knee injuries and shoulder injuries. Especially in football, and even a common man in his house or when he's walking on the street also might end up with a knee injury. Very commonly, the anterior cruciate ligament injury is very common among sportsmen as well as in general public who has road traffic accident or while getting down the stairs. When such injury happens, usually patient complains of pain, instability, and he won't be confident enough to walk on the street, and he'll always look down and keep walking. For such cases, what we do is you should immediately come to the hospital where we can examine the knee and we can see which ligament is involved. And it doesn't mean that all anterior cruciate ligament injuries require surgeries. Some can be treated conservatively depending on their activity and depending on their age. So when the patient comes, we will examine, we will see where is this tenderness, we will see all the tests for the instability. And we usually do an X-ray first. We'll see if there is any bone injury, and then we go in for a MRI. Usually when we do an MRI, in an MRI we can see whether it's a partial or a complete tear, or any associated injuries like whether he has a meniscus or he has a intra-articular fractures. Looking at that, once I can decide whether depending on the patient's activity, whether he has to undergo arthroscopic ACL reconstruction or it can be treated conservatively. So with the help of a physiotherapist, we can put the patient to a good rehab center where he can strengthen his muscle and get back to his normal activity. But if he's a sportsman who's an active, like pivoting movements where there's a lot of rotation involved, that time we need to decide whether the patient has to undergo surgery or not. But if it's a partial tear, usually sometimes we try to treat it conservatively with good rehab and put him back into his game. But if there is a bigger tear and he's highly unstable, then it's better to undergo a ACL reconstruction. So to conclude, whenever there's such injuries and when you have certain instability and pain in the knee, it's always better to visit the hospital, visit a sports medicine consultant. Thank you.